Hello, good afternoon, everybody. Thank you for joining us for our webinar today. A lot of friendly names and faces I saw joining our webinar today. So good to see many of you um, on this sunny, warm summer afternoon that we are finding as our here in Colorado. I am Megan Wilson. I am Deputy Director of Delta Dental of Colorado Foundation, and I am really excited today to share with you more details and information and then opportunity to answer any questions about our responsive grant opportunity that we have just launched for 2021. As we dive in to this conversation today, I just want to say how appreciative I am of the work that you all do across Colorado. And I'm really looking forward to getting to know you and your community in the future as we review grants and engage with you this year and in the coming years. I will be focusing our conversation today on our 2021 responsive funding opportunity, the details and the timeline for that. I will make sure to leave time at the end for questions, but I also encourage you to post your questions in the chat feature of Zoom as we go along. I have a really remarkable team of people supporting this webinar, and they will be monitoring the chat and capturing the questions as we go along. So please be sure to use that chat feature as well for your questions. At Delta Dental of Colorado Foundation, we believe that a healthy mouth leads to a healthy life. Every day we partner with communities to reimagine how all of our neighbors access, benefit from, and value the importance of proper oral health care. Because when we go the extra mile for every smile, we elevate the well-being of all Coloradans. We know that good oral health care is not solely dependent upon one's ability to have a dental clinic or provider in their community, although those are very important parts of being able to access, understand, and value good oral health care. But we also know the social determinants of health directly impact one's ability to have good oral health care. I know with this audience, I do not need to delve into what the social determinants of health are. You all are certainly well familiar and in often cases experts more than I am. But we know that if one can't access a dental provider because of transportation, if they have fluoridated water, what their housing and food access looks like, those all have a direct impact on one's health and oral health. This is our theory of change, and we consider it our North Star. Through our grant making, we intend to impact our goals and benefit communities facing oral health inequities. We have worked with the Colorado Health Institute over the years to really understand through the data and through community surveys and scans, the populations that face the greatest inequities in accessing oral health care. And ultimately and collectively with you, we seek to improve the well-being of all Coloradans. Delta Dental of Colorado Foundation is a health equity foundation. Equality refers to equal opportunity and the same levels of support for all segments of society, whereas equity refers to offering varying levels of support depending upon need to achieve greater fairness of outcomes. Equity is a process, and equality is an outcome of that process. Oral health equity isn't one size fits all. There isn't one solution for everyone. That's why we are fostering an open dialogue, getting out into communities and partnering with a variety of organizations so that we can understand, work with you, and learn from you about what your community needs to access, understand, value, and prioritize good oral health care. Every community has unique needs, assets, and priorities. We want to understand again what your community needs to be healthy. Our work begins by cultivating partnerships with organizations. Together, we can address community needs and implement activities to improve oral health. These partnerships make the greatest impact in Colorado communities. We'll be talking about our prevention and place-based access to care initiatives in the following slides, as those are the two initiatives that this responsive grant opportunity is focused upon. We are accepting applications for grants aligned with our prevention and place-based access to care initiatives. Let's talk about our prevention initiative first. The guiding vision is that all of Colorado's young children, their mothers, and pregnant women will have access to convenient, timely, preventive oral health services. We believe it's important to instill good oral health habits in early childhood to ensure a healthy mouth throughout life. Caries, or cavities, can be spread from baby teeth to permanent teeth, and there are clear oral health connections to healthy pregnancy outcomes. Furthermore, the inability to introduce oral health hygiene early in life can cause significant physical, mental, and social complications later in life. For example, toothaches can impact a student's grades by making it difficult to focus in class or causing the student to miss school altogether. Preventive oral health care consists of efforts such as regular oral exams, along with good oral hygiene to stop tooth decay, and disease before it can take hold. Our place-based access to care initiative has a guiding vision to work alongside community organizations to understand, identify, and address opportunities and barriers for people in that region to access, understand, and prioritize good oral health care. This initiative is specifically focused on two Colorado regions, the San Luis Valley and East Metro Denver. For this initiative, we seek to partner with organizations that are directly working with and serving people living in these regions. Now, I want to clarify that does not mean your organization must be physically based in either of these regions, but it is critically important that the work you do directly serves the people living within these regions. I also want to point you to our website and the grant guidelines on our website, which give more specification about our East Metro Denver region by identifying the neighborhoods and geographic area that we are specifically focused on. We understand that both of these communities face significant and different challenges to community health. The economic stability of a community, utilization of oral health care, and insurance coverage all impact one's oral health. Again, every community has unique needs, assets, and priorities, and we want to understand what your community needs to be healthy. Our work begins by cultivating those partnerships and learning from you, because together we can address community needs and implement activities to improve oral health. These partnerships are how we reach our ultimate goal to improve the well-being of all Coloradans in partnership with you. I also want to comment on general operating and programmatic grants, as this grant opportunity is open to either type of grant request. However, I do want to provide a little bit more guidance for general operating grants. We feel that perhaps a best fit for a general operating grant is an organization that primarily or significantly focuses on oral health work. It's really a core part of the programming that you offer. If your organization is broader in scope, offering a lot of different important services and resources to your community, and oral health is a part, but not majority part of that work, a programmatic grant might be the best approach for you in filling out this application. Our team is available and welcomes any outreach and questions and conversations as you complete your application to help guide you and identify perhaps the best type of grant or the work that might best align with our grant guidelines. And I will share that contact information at the end of this webinar. I do want to point out that the applications are due at midnight on August 22nd, 2021. Because we are using an electronic application system, our system will lock down at that time. So plan ahead, do your diligence, and get your application in before midnight on August 22nd. We are modeling and building this responsive grant opportunity from our successes and learnings over the past several years of doing this work. Many of you have partnered with us in the past, and we hope that you continue to partner with us and that we partner with many new organizations as well as we seek to identify innovative and impactful programs across Colorado. Our proposals are ultimately working towards these indicators for our prevention initiative and our place-based access to care initiative. For both initiatives, priority will be given to organizations that are focused on systems change and long-term approaches to improving access to care. We are not looking to fund Band-Aid or immediate response programs, but rather responding to the real needs that you might have in your community and thinking about how we can make those opportunities for long-term impact for the benefit of all of our neighbors. We also are looking to partner with organizations focused on historically underserved populations that face oral health and overall health disparities. Populations may experience disparities due to race and/or ethnicity, geography, socioeconomic status, or age, as examples. For our prevention initiative, applications must demonstrate tangible oral health services to the focus population and a demonstrated partnership or provision between the applicant entity and a dental provider for preventive oral health care services. We seek to fund organizations or programs that connect and integrate preventive oral health care into community settings, more than funding standalone oral health care provision. Again, we are really looking, excuse me, to change the system and meet people where they are in preventive oral health needs for young children, and valuing the oral health care for pregnant women and young children. We seek to identify innovative efforts that are scalable or replicable and advance access to preventive oral health care. For a place-based access to care initiative, applications must directly serve people living in the defined regions, as I mentioned earlier. We welcome innovative or collaborative proposals addressing the multitude of opportunities to increase oral health access and utilization. There are a number of things we are not interested in funding as part of this specific grant opportunity. One change from our prior grant opportunities is that we will not be funding capital costs within this grant opportunity. If you seek funding for capital expenditures, like building a new dental clinic or building out an operatory, please contact us if you have questions about that, or visit our website to learn more about our Oral Health Capital Loan Fund opportunity, which is a new effort we launched this year. If there are some capital costs that are part of your programmatic efforts, please, again, contact us to discuss what that might be and confirm or clarify if it's a fit for this grant opportunity. Applications that do not clearly align to the detailed funding strategies will not be considered. The application must include, and we ask questions about, your specific goals, objectives, and deliverables to be carried out within the grant period. Again, we want to get to know you and understand the work you do. All grant applications, whether focused on prevention or place-based access to care, should include efforts and interventions that use data to inform, measure, and develop their work. What that data looks like and how you evaluate might look different for each of your organizations and how you approach that piece of your work. Innovative grant applications designed to meet community need through new untested efforts or proven evidence-based programs being administered to a new population or in a new geography might be of interest as well, as are grant applications for traditional methods proven to improve oral health. When possible, again, please use data to inform your proposal concept and help us better understand your outcomes and the work you do. As part of the application, organizations will be asked to specify their evaluation or how you understand how you impact the community that you work with, as well as provide details about outcomes and community that you serve. The application seeks to understand community demographics, whether you know those in a detailed factual basis or you estimate those demographics to help us understand the impact and breadth of our funding. We really seek to understand your intuitive and data approaches because that is a great learning opportunity for us at Delta Dental of Colorado Foundation to understand the needs across Colorado and how we can best help support those needs. So what does the application process look like, you might be asking? We have an online grant management system called Foundant that accepts all of our applications, and the link to apply is on our website. Once you've logged into the system by creating a new account or accessing your existing account, you can work on your application. The application will cover things such as general information on your organization, the community you serve and demographics, a description of your community need, the opportunities and the challenges, And then you'll be asked to upload some documents such as financial statements and budget. We do have a unique question that I want to take a moment to call out specifically. The question is to tell us about your organization's overall financial health and your availability and access to resources that may or may not be demonstrated in your financial statements. This is an optional question. However, our intent here is to learn from you what might not be fully explained in your financial statements. For example, you might have access to human, social, or intellectual resources in your community that doesn't show up as dollars and cents in your financial statements. You might have a healthy cash reserve that's being saved for a significant capital expense or campaign. And we want to understand what those are so we really understand who you are as an organization. And we really hope you feel comfortable in sharing this information with us to help us start a conversation and understand the big picture. Once your application is received, it will be assigned to a member of our program team for a thorough analysis. Your program officer will contact you and might request a site visit. We are hopeful that we'll be able to get physically back out into communities and meet with you and see your neighborhoods and your communities, following all COVID protocols and safety precautions, of course. If your application does not meet these guidelines, you will receive a notice of early declination by September 17th, and final decisions will be notified. You will be notified of final decisions by November 19th, following our board meeting. Grant periods will begin January 1st and go through the duration of 2022, if it's a single year grant, or on a calendar basis if a multi-year grant. Now, I open it up for questions that you might have, and my team will feed me the questions from the chat box that have been posted along the way. But I also want to reiterate, this is not your only opportunity to ask questions. Please contact us. Submit questions to grants@ddpco.com, and that email will make it to a member of our team who will respond and connect with you to further discuss your proposal or answer any questions that you might have. Thank you for joining us today, and now I welcome your questions.
We've got our first question from the chat box, and that's, can you please explain what is meant by serving in community-based settings?
So what it means to be serving a community-based setting is an organization that is in a community serving the members of that community. That might be a family resource center or organization similar to that. It might be a child care center. Any type of an organization that is really based in and serving members of that immediate community. You might be collaborating with your local oral health care provider or local clinic to bring oral health care into that setting that you offer, or vice versa.
Is our organization eligible if we're a current co-MDI grantee, with the final report due April of 2022?
Yes. If you are a co-MDI grantee with the final report due in 2022, your grant or your organization is eligible to apply for this funding opportunity. The reason being, co-MDI is a very unique program that has been administered by the Delta Dental of Colorado Foundation over the past several years, and we are strictly in the evaluation phase of that current co-MDI program. So we consider you eligible to apply for this opportunity.
Expanding on that question a little bit, what about other current grantees?
If you have a grant that is ending in 2022, generally speaking, you are not eligible to apply because you have an existing grant with our organization. If your grant is ending this year in 2021, you are eligible to apply. That being said, I understand that you might have individual questions on your grant or your organization if you are a current grantee ending in 2022, and would encourage you to outreach to your program officer or to our grants@ddpco.com email with any questions or clarifications.
And could you remind us how much funding is available to request?
We are accepting grant applications between $10,000 and $100,000 per year, up to, I believe, 3-year. Looking to my team to keep me honest here. Between $10,000 and $100,000 per year for up to 3 years, or you may again apply for a single year grant.
I have a question, if I may ask. Is that okay?
Yes, please go ahead.
Okay, so my question is, if we have a grant that is currently running and it's ending in 2021 this year, and that grant is serving not necessarily children, but it's also serving underserved communities. This grant potentially will not cover that. Is that correct? Because this grant apparently is for children 0 to 6 years or 5 years. They are mothers and pregnant women. So the other people that we are serving now, even though they are underserved and relatively poor, this grant will not cover those people if assuming that we get this grant, correct?
So let me clarify. Thank you for that question. When you log into the system and apply for a grant, you will be asked to identify if you're applying for the Prevention Initiative or the Place-Based Access to Care Initiative. If you are applying for the Prevention Initiative, then your grant does need to be providing preventive oral health care services to children aged 0 to 6, pregnant women, and or mothers of those young children. However, if you select that you are applying for a Place-Based Access to Care Initiative, you can be serving people of any age within those defined geographic regions of the San Luis Valley or East Metro Denver. That Place-Based Access to Care Initiative does not have age parameters for the population to be served. Rather, it's the community at large.
Okay, thank you very much for that explanation.
Yes, thank you.
From the chat, is this the only funding opportunity that will be available this year? Is it anticipated that new co-MDI funding will become available at a later time?
This is the only responsive grant opportunity that we will have available in 2021. We are in the process of identifying and determining the future funding opportunities specifically for co-MDI or the Colorado Medical Dental Integration Project. We have not yet made those determinations. So I cannot say in this moment if we will open an opportunity in 2022 for another wave of co-MDI grants or not. But this is our only responsive opportunity in 2021.
I have one more question.
Yes, please.
Which is your priority area, place-based or preventative care?
Oh, you're asking me who my favorite child is here, and I can't tell you that. They both are of equal priority to this grant opportunity.
Right. The reason I'm asking this is that because I mean you have indicated that there are for the place-based, you can apply for any you can apply the grant to any of the populations that are in particular area. But from my reading of maybe reading it wrongly, it seems to me that I mean there's a lot of emphasis on young children and prevention. And so it is from that perspective that I was trying to find out whether you have a priority in terms of either place-based or prevention, which currently is focused on children and their mothers.
Sure. It really is equal priority and equal funding availability across each of the prevention and place-based access to care initiatives. If you, Bakari, want to outreach to us for a more specific conversation, we would welcome that. Knowing your organization, I would at this point in time wager that the place-based access to care might be the better fit. But both initiatives have equal priority and equal funding opportunity as part of this. And again, this is where we really welcome, genuinely welcome those conversations between our team and your organizations and your teams to really figure out what might be the best initiative to fit your work into.
Thank you very much. Yes.
Do you know how much funding you intend to distribute with this round of grants? Is it comparable to what you've been able to do in past years?
We have a slightly smaller pool of funding available for this round, and I am going to frankly not answer that question with a specific dollar amount because we have some flexibility on our end based upon the volume of applications that we receive around the amount of funding that we might be able to dedicate to this grant opportunity. We know from our past grant opportunities that, or we anticipate based on our past grant opportunities, that this will be a competitive round of funding. We know that there's a lot of really good work happening across Colorado and within these regions. So we do anticipate it to be competitive. That said, please do not hesitate to apply, and please do not hesitate to apply for the amount of funding you truly need to serve your organization, your programs, and your community. Do not think that if you apply for a smaller amount because this might be competitive, that gives you a greater likelihood of getting a grant. We rather would see you ask for what you need to do the work to serve your community. Veronica will keep bringing up the questions that are posted in the chat as they come through. I'm thinking she doesn't have any at the moment. So if you have other questions that you've not posted in chat and anybody simply wants to unmute yourselves and ask them, I welcome you to do that as well.
I'm going to throw out another question from our FAQs here. If someone would like to apply, but they're not located in the San Luis Valley, but in a neighboring county, and they've received funding in the past, are they eligible to apply?
Yes, if your organization is not physically located in the San Luis Valley, as within this example, your organization is not physically located within either of the defined regions for a place-based access to care. But the work you do directly serves people living within those regions. You are eligible to apply. Again, our intention with our place-based access to care is to really work alongside community organizations and the communities themselves to understand the opportunities and the barriers to good oral health care, to increase access to oral health care and utilization of oral health care. So if the work you do is tangibly serving people in those defined regions to access and utilize oral health care, then we welcome you to apply, whether you're physically located there or not.
And can organizations submit more than one application?
No, we seek one application per organization. So if your organization has multiple programs that you feel like might fit both or either of the initiatives that we've been discussing here today, I would encourage you to figure out or consider What is your greatest impact and your prioritized work so that you can submit one application? Or how do the programs intersect with one another for impact to your community? But there is only one application per organization accepted. I will give us another minute or two here if people have other questions to think of. But again, a couple points that I simply want to reiterate is that the application deadline is midnight on August 22nd. That gives our team time to review, meet with you, and bring recommendations to our board, bringing those grant determinations back to you mid-November, mid-late November. And as in the past, we really do want to engage with you in conversation as you complete your application, if you desire that support, in figuring out if you are a good fit, which initiative might be the best fit for you to apply, or any other questions that help you determine how to best submit an application. And you may reach our team if you don't know one of our program officers, if you don't currently have a program officer with our foundation, or even if you do, utilize the grants@ddpco.com email, and that will be directly connected to our programs team, and somebody will respond to you quickly. Veronica, do we have any other questions in the chat?
No further questions.
Well, I want to thank my colleague Veronica here for helping me facilitate our conversation today and bring this webinar to all of you. If you have questions, again, please don't hesitate to outreach to us. It is good to see many familiar faces and names on my Zoom screen here, and I can't wait to see many of you in person and in your communities as soon as we possibly and safely can all be back together. I will give one last opportunity if there's a question that has come to mind for somebody. And I've told I have one last slide that I was ignoring. Thank you. So this is our website. Thanks, Veronica. This is where, teamwork makes the dream work, right? This is our website. If you haven't already stumbled and explored our brand new website, a lot of great new information on there. This also is where you can find the detailed grant guidelines and the link to the application. Also, please follow us on social media. We like to engage with our community members through social media as well. Thank you all again for taking the time to join us today. And even more so, thank you for the work you do across Colorado, increasing oral health equity for all Coloradans. I really do appreciate what you do every day and the impact you are having for our neighbors. Thank you.